Who responds best to immunotherapy for cervical cancer? Imagine a treatment that helps your immune system fight cancer more effectively. That's what immunotherapy aims to do, especially in cervical cancer. But not everyone benefits equally. So, who responds best? The answer lies in specific biological markers found in tumors. Patients whose tumors produce high levels of a protein called PD-L1 tend to respond better to immune checkpoint inhibitors like pembrolizumab. PD-L1 acts as a brake on immune cells, and when tumors express it, blocking this brake can unleash the immune system to attack the cancer. Doctors assess PD-L1 levels by examining tumor tissue with special staining techniques. If the tumor is PD-L1 positive, the chances of responding to immunotherapy are higher. Another important factor is tumor mutational burden, or TMB. This measures how many mutations are present in the cancer's DNA. Tumors with a high number of mutations are more likely to be recognized by the immune system, making immunotherapy more effective. About 21% of cervical cancers show high TMB, which has been linked to more durable responses to drugs like pembrolizumab. The immune environment within the tumor also matters. Tumors with many immune cells called tumor-infiltrating lymphocytes, especially CD8+ cytotoxic T cells, tend to respond better. These immune cells are the soldiers that attack cancer, so their presence indicates an active immune response. Conversely, tumors with more regulatory T cells, which suppress immune activity, often respond less well. The type of cervical cancer also influences response. Squamous cell carcinoma, the most common form, usually has higher PD-L1 expression compared to adenocarcinoma, suggesting it may respond more favorably to immunotherapy. Most importantly, patients with advanced, recurrent, or metastatic disease often see the most benefit from immunotherapy. When standard treatments like chemotherapy are no longer effective, immune checkpoint inhibitors can provide new hope. The Food and Drug Administration has approved pembrolizumab for PD-L1 positive cervical cancers that have persisted or recurred after chemotherapy. Clinical trials have shown that combining pembrolizumab with chemotherapy and radiation can improve outcomes in high-risk cases. However, not all tumors respond well. Tumors with low immune cell infiltration, sometimes called cold tumors, tend to be less responsive. Researchers are exploring ways to modify these tumors to make them more receptive to immunotherapy. This includes combination treatments that can boost immune activity within the tumor microenvironment. In summary, the best responders are those with PD-L1 positive tumors, high tumor mutational burden, and a favorable immune environment. Patients with advanced or high-risk disease are often the focus of current immunotherapy strategies. Ongoing research continues to refine how we identify who will benefit most, aiming to personalize treatment and expand options for more patients. Always consult healthcare professionals for individual advice, as each case is unique and requires careful evaluation based on the latest scientific evidence.